Analysis and review of the ECG Interpretation Mobile Application by Elise Crosby, RN. Mobile medical apps have been shown to assist healthcare professionals in rapid decision-making with less degree of error, leading to improved knowledge and efficiency. These benefits have proven to be a positive influence on patient outcomes. Mobile cardiology-related educational apps offer convenience, efficiency, and improved clinical decision-making capabilities. The ECG interpretation application is a mobile app providing diagrams of electrocardiographic rhythms with corresponding identifiable characteristics and measurements. The app is an effective tool for analyzing and diagnosing a wide range of rhythms. The application may be useful for nurses who are new to cardiac care, as well as for those who wish to refresh their knowledge. Having an easily accessible resource has proven beneficial in quickly diagnosing cardiac rhythms and guiding clinical decision-making. The ECG interpretation application can be found for free on the Google Play Store. Contained in the ECG interpretation app are links to pictures of 31 ECG arrhythmia tracings and rhythm complexes, many with diagrams that include information on the variables that will help identify the rhythm in practice. Underneath each picture is verbiage outlining identifiable characteristics of rhythms and measurement parameters for identification. Many descriptions include an explanation of the electrical conduction of the heart and other contributing factors resulting in the rhythm, as well as information about causes and treatments. Mobile medical apps have proven to be valuable tools in aiding clinical decision-making at the bedside. The ECG interpretation application can be used by nurses as a valuable resource in identifying cardiac rhythms. The app would be beneficial for those new to cardiac nursing, as well as for student nurses learning how to interpret and identify rhythms. Cardiac nurses may use the app for differentiating between similar rhythms or for identifying rare rhythms. The app may also be used to clarify a rhythm prior to seeking treatment. The ECG interpretation app has a straightforward layout that makes it easy to use, and learning how to navigate through the application is instantaneous. The main screen provides a simple list of links to each rhythm. These links are located on color-gradated bars, making each link easy to read. Each link provides an image or diagram of the corresponding rhythm, and descriptions are located by scrolling down. The first link provides a labeled diagram of the intervals in a complete sinus cardiac cycle, giving the user a foundation on which to build while interpreting the subsequent arrhythmias. The tracing descriptions use medical terminology that is not explained for the layman, making the app exclusively for medical professionals. However, if one is familiar with ECG terminology, the wording is succinct and easy to understand. The application is not interactive, meaning there is no way to input information or search for a particular rhythm or characteristic. Though mobile health applications provide convenience and efficiency to healthcare workers when caring for patients, there are many legal and ethical risks, including disclosure of protected health information. Applications in which information can be entered pose the risk of unintentional sharing of health information through collection by third parties. Aside from potentially using a personal device while active at the bedside, I do not see any legal, ethical, or privacy issues with the ECG interpretation application. Though using a personal device at the point of care may lead to the rare occasion in which a patient's information is shared, there is no way to compromise confidentiality when simply using this application. Information can't be entered into the application itself, making it impossible to disclose patient information either purposefully or through third-party data collection. The information provided outlines long-established features of rhythms. The information can be trusted to guide care. There are several benefits and a few disadvantages to using the ECG interpretation app in practice. The benefits of the app are its convenience and ease of use, and its provision of accurate information about arrhythmia interpretation, causes, and treatments. A concerning disadvantage lies in the fact that the application may be accessed on a personal device at the bedside, both increasing risk of sharing patient information while also potentially diminishing trust in the nurse by the patient. Its lack of interactivity poses both a benefit and a disadvantage. There is no risk of sharing confidential patient information while simply using the application, but there is no way to search within the application or assess ECG interpretation knowledge. Overall, I would recommend using the ECG interpretation application to fellow nurses. Its ease of use and quick access to clear images and accurate, simply stated ECG interpretation information makes it an excellent resource for cardiac nurses and nursing students when learning and interpreting arrhythmias. The app poses no legal, ethical, or privacy concerns, making it a safe means of learning and diagnosing arrhythmias in the patient care setting. Thank you for listening to my presentation on the ECG Interpretation mobile app.